Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and today we're going to do some lip filler. So I have my lovely assistant, Nicole.
Hi. I'm so excited, I can't handle it.
And so we had a little bit of topical on, we've already cleaned her.
Yeah, I'm super numb, I feel like I'm numb to my eyeballs.
Yeah, which is good, because we want it to be nice and comfortable. So we are going to use Volbella today. And what I like about Volbella is it's nice and soft, and you're not going to overdo any lips. Nicole has small lips, so we do not want to put too much filler in. We want her to look very natural. Okay, are you ready? Mm-hmm. Okay, here we go. So when we're doing lips, we have several different options. Hang in there. And you'll feel that first one, and then hopefully it numbs up even more. But anyway, we have several different options for filler, and Volbella is an excellent one for those who really don't want big lips. They want just a little bit of plump. They want just a little bit of definition. Doing okay? Mm-hmm. Okay. And then, like I said, not huge by any means. Not that anybody really wants big lips. Sorry.
It's okay. I didn't feel you.
So you can already see the change. You see that? Just a tiny bit. And again, we don't want to give her big lips. But Volbella lasts up to a year. Good. Now our other options are Juvederm Ultra and Juvederm Velour. And those are just a little bit thicker products. So you'll have a little bit more volume with those. Okay, turn towards me for a second. Good. So you can already start to see the nice change between the two. And what I'm going to do is I'm going to come over to the other side. Actually, let me let you take a look and see what you think. You already see the difference there?
Oh, yeah.
You like that size? Maybe a little more in a minute. Okay. So that's what we do throughout our filler treatments, is I show you as we go. And we can decide together how much plumpness you want. Here we go. Good job. Hang in there. Good. So as you can see, I don't talk as much when I'm doing filler. There is truly an art to this. Doing great, girl. The nice thing, let's put a little bit more on that side. The nice thing with Volbella is that, are you doing okay? Mm-hmm. Is that it really does not, you really don't get a lot of swelling with it. So pretty much what you see is what you get. And that's really nice, because you'll see this instant plumping. And it's been a couple years since we've done Nicole's lips where we don't get as many treatments as we would like. I know I'm overdue for mine too. Okay, let me see you. We need a little bit more. That's looking good. Here we go. Hang in there. Good. So you're going to feel it a little bit. I mean, nothing is pain-free, but I'll let you describe it, but it's not terrible, but you definitely will feel it.
It's really more when she pokes right through the skin. Once she's in, I'm fine. It's just kind of breaking the barrier of the skin. You just feel it.
And you're funny, you just feel it, and she's numb, so having a hard time talking too.
I know, I can't talk. I'm so numb, but it's hard to describe the feeling, but you just kind of feel the needle go in, and then once she's in, I can almost not really feel it.
Yeah, and this has lidocaine in it, so it numbs as we go. Okay, open up just a touch. We're going to go to the bottom here. Good. So when you come in and we decide that we are going to do lips, we discuss the different options. And as I said, there are 3 options that I like to use. And it really just depends on what you're looking for. Look at the difference by just adding just a little bit on the side there, and you can see the deficit there. I haven't done anything here, but we're going to put a little bit in there too.
I didn't even feel that last.
Oh, good.
Some
The
of them I
bottom,
don't feel.
yeah, the bottom is not as, you don't feel it as much as the top. Okay, so we'll go a little on this side. Here we go. And then anyway, so when you come in, we talk about the 3 different products. We decide which one is best for you. And then we go ahead and inject. Open just a touch for me. Turn this way.
You don't really feel the
Didn't feel that? Good. Okay, let's put a little bit in the center, and then I'll let you look again. Hold that one just a touch. Good. Oh, they look good. Okay, let's see what you think.
Oh yeah, I didn't realize I'm peeling.
What do you think?
Yeah, they look good.
Okay, do you want a little bit more on the top?
I'd rather, yeah.
Okay.
My bottom lip is not as bad as my upper lip. It's just very hereditary. My whole family has very thin lips to begin with. So I've slowly built on and added, gotten a little bit and built on over the years and just kind of routinely maintained my treatment to get them, my upper lip a little bit bigger.
Okay, and that's a good point. Usually with filler, we want to do every 6 to 9 months with lip filler. And before I do that, just take a look at the camera. And you can't even tell she had anything done, which is really nice. When we do filler, we want to make sure that you don't have any events for about 2 weeks, because you definitely can bruise. Most of the time when we do lips, you can cover it very well with some lipstick. But we definitely want to plan around any events, and you want to give it enough time to heal just in case. Okay, chin down for me. Let's do just a touch more on the outside. And then other than that, really, we just want you to stop anything that can thin your blood. So aspirin, ibuprofen, Motrin, fish oil, vitamin E. Okay, excellent. And then the downtime, she'll be numb for the next couple of hours, and then she'll feel like she's a little bruised, probably, like just a little tender, and that'll be 24 to 48 hours. As I said, there's not a lot of swelling with Volbella. I tend to find more swelling with Ultra because it pulls more water, and so then it creates just a touch more swelling. Turn towards me. And then we usually will see you back at 2 weeks so that we can see how we did and make sure that they're nice and even and that you love them, and everybody does. Okay, turn towards me. I need just a touch more on the top here, and then we should be done. Here we go. Oh, hang in there. Doing okay?
Mm-hmm.
Okay. Just about there. Okay. Okay, turn towards me. Chin down for me. Open just a little bit. I want you to smile real big. Good. Still looks very natural. Okay, look into the camera. Those look good. And remember, she's a little numb, so when she smiles, her smile's going to be a little bit off. Oops, hold on, let me get this for you, sorry.
Oh Oh, yeah.
What do you think of that size?
Yeah.
Okay, good.
Do you have a little bit left?
I do.
I'll use it. Okay.
Yeah.
I think that's all I need.
I want to do just a little bit on the corners.
Yeah, that's perfect. Yeah.
You like the size?
Mm-hmm. Yeah, I think it looks good.
She's my worst critic, so if she thinks it looks good, then it looks good. No.
Okay.
No, I do not think you should go bigger. And we have this conversation all the time, and I always ask when patients come in, I'll say, this is a crazy question, but how big do you want your lips? And some people are like, oh my gosh, I don't want anybody to know I had them done. So then I know to go more on the Volbella side. Mm-hmm. But some people come in, they say, listen, I don't want them, kind of big, but I do want them big enough that I can tell the difference. Mm-hmm. And then I know to go more towards the ultra side. Mm-hmm. And let me finish this, and I'm going to show you, I have a before and after hanging of the ultra. And the purpose of lips is to just give them some definition, give them a little bit of oomph, give them like, you have a lip plump on. It's not to make these humongous lips. She couldn't handle big lips. She would look ridiculous with big lips. These are actually big for her, but they look so natural. So what I'm going to do now, I have a little bit left in the syringe, and see she has just a little downturned mouth. So I'm going to put just a touch of filler to pull this up a little bit on each side. Let me just get... Okay, this isn't as bad either, so okay, here we go. Just a little bit, good. And this is just giving some support on the edges of the lips and just lifts them nicely. Then I'm going to come from underneath and do just a touch more support. Excellent. And so now you can see it comes more straight across versus going down. Okay, here we go. Good job. Good. A little bit from underneath. Excellent. Good. And so that just took that straight across too. Now another area when I'm doing lips, another area that I really like to do is this area through here. I have just a touch left, so I'm going to put just a little bit on each side. Here we go. And that one, you definitely feel a little bit more, but it's still not terrible. And I don't have enough to make much of a difference, but again, it's just giving a little bit of support. And what this one does is it actually melds into the skin, and it gives you a little bit more like textural changes. It'll help with the fine lines and wrinkles down in this area. Not that she has any, but for other people that do have some. So that is a lip injection, which I don't know how long that took, but not very long at all. I take my time. I really want to make sure that everybody's on the same page and we all love it. When I evaluate patients and they're not just doing lips, we actually will start with the cheeks. Now again, she's super young, so she really doesn't need anything else going on in her face. But most people will come in and complain about this area through here. So we call this our nasolabial folds, and we call this our marionette lines. To fix this area, we actually will inject up here, and you can see she doesn't need anything. But you can see a little bit of pull on her jawline. We'll have to get somebody else in here who actually needs filler, and it'll pull all that area up. So when we do cheeks, we see a change under the eyes, in the nasolabial, in the marionette, and also the jawline. And then, big surprise, you actually see a nice change through here. It'll lift up any loose skin down here. So that's why we love Voluma, which is the one that we're going to use in the cheeks. And then we work our way down. And I typically will say that the lips are more icing on the cake. So once everything else is nice and beautiful and lifted and just giving a very natural tweak, we put some in the lips, and that gives the finishing product. Because as we age, we start to lose our lips. and they just start turning under. And she's young, she never really had them to begin with, so this is just giving her a little bit of a boost. Yeah. So, all right, so let me give you the final look, and while you're looking at that, what do you think?
Good.
You like them?
Yeah, that's all I needed.
Okay,
Yeah,
good. She did tell me that she wanted to do Ultra earlier today when we were talking about it, and I said, I think Volbella is enough. So
I've always done Volbella, and I'm comfortable with it, and I know how the result is with Volbella, and I was like, do I want to go bigger today, or?
And that's what I'm going to tell you. Yes, you can, or no, you cannot, because you're walking out of here, and I always say you're my walking billboard. So I need you to look very natural. She's definitely my walking billboard because she's my assistant. And so she has to look natural. We don't want anybody looking at us going, oh my gosh, what did they do? You know, I don't think anybody will notice, except for if you're watching the video, that she had these done. So I love them.
Yeah, they look good.
If you don't mind, cameraman, move you right over here. So this is 1 syringe of Juvederm Ultra Plus. And the reason why she wanted her lips done is because she has these upper lip lines. Can you see it on there? So she has these upper lip lines. So with Ultra, I actually did not even touch the lip lines. I gave her definition around and then gave her a little bit of oomph on the inside. The lip lines are still there, but it's camouflaging them. Because those lips look so beautiful, you don't see the lines as much. This was before we had Volbella, and now Volbella, you can actually use it up on here. But I still put it in the body of the lips first, and then we go back through, do our corners, and do a little bit on that upper lip, and if we have to, we come down in the lower part. But if you look at this picture, you know, you really can't tell that she had anything done at all too. So that's our purpose, is that we really want very natural looking lips. Everybody's afraid of doing lips because they see what the movie stars do. And in the end, it's not really about that. It's we really want you to have natural lips, and that's what we can do for you. So if you have any questions or you know, want to get your lips done, we would love to see you, and our phone number is 618-288-9117. Thanks for watching.